Dr. Cecilia Losentales to talk about the vision that she's had and how she's put this wonderful hospital together, kind of integrated new technologies with old homeopathic and acupuncture and other Eastern medicines, correct? And she's done just a marvelous job. I applaud you for it because it's something that I've been in the process of trying to accomplish. And I'm going to let you go ahead and kind of tell the story from when you started and how you've become multiple hospitals in the Philippines, correct? And then also with your vision of taking this globally. But initially, right now, we're focused on bringing these assets that we're working through for the show to fund and bring you to another level of having the top equipment and also being able to see your vision through to the larger scope of what's going on. So I'm going to let you, Dr. Cecilia, and she's going to let us know exactly kind of where you started in that. I think it's a good place to go from.
Yeah, I started this work or profession because I'm a leukemia patient before. I used to have blood transfusion, my hemoglobin went down into 4, and because of that, my doctor told me that I will be diagnosed in US, but we are poor, so we could not go there. So my mom is having herbal concoction, in the province we used to have herbs, so he gave me herbs, and when I learned about naturopathy, I studied naturopathy. And I practiced naturopathy and I applied that to myself and I was cured. So I make it as a career. So when I started my clinic in 1994 in General Santos City in Mindanao, then I opened up my branch in Davao City in 1998, and in 2000 we opened up 2 branches, Manila and Cebu. And in that year, we started our inpatients. So before we do outpatient only, but we started the inpatient so that we can manage the patient very well. And for that, first we do 100% natural healing or naturopathy using natural modalities. But in 2001, we integrate that with medical because of some of our cancer patients. We need integrating modalities or integrated management for cancer patients because there are some cancer patients that you need to give more antibiotics, some for the infection, but mostly we give naturopathic.
So that's your focus of right now.
Yes, so now we have in-house, and it is good because from stage 1 to stage 3, patients 100% curable.
100%
Yes,
curable.
But for 4th stage, then we just prolong life. But sometimes they are reversed also.
Is that right?
Yeah, it
stage
depends upon the body.
Correct.
But for stage 1 to stage 3 without complication, it's curable. So we learned that because we have plenty of our patients now. 90% of our patients are cancer patients. So for 21 years of practice, we observed that cleansing is the basic in treating
that's the starting
cancer
point.
Patients. Yes.
Cleanse their body of any
Cleansing,
toxins.
yes, eliminations, detoxifications, then we have repair or strengthening period, rebuilding period, and nourishing period or balancing period. So for cancer patients, you have to 6 months for that, for the body to eliminate, to regenerate, and to nourish.
And you
you
also
can have a balance already.
Correct. And you do certain if it's from fruits or vegetables or whatever the.
So the modalities that we have, it starts with a diet. So we have 4 kinds of naturopathic diet. We have cancer diet. We have renal failure diet, we have wellness diet, and we have the diabetic diet. So because they are all different.
Yes.
Then for juices, you have also the cancer juices, renal juices, diabetic juices, and wellness juices. And of course, you have the herbal therapies with the food supplements. We give cleansing supplements, strengthening supplements, and balancing supplements. Then we have other modalities like colon irrigations, coffee enemas. We have electromagnetic like biozapper,
Yes.
biotense as acupuncture. We have infrared, so those are electromagnetics. Then we have also Bintosa, the bohang, no? It's
Bintosa,
Bintosa.
a bohang? What is
Yes, the
that?
bohang is a Korean traditional medicine, but in the Philippines we call it Bintosa. Of course, we have the hilot, the Philippine hilot,
Okay.
which is another name of the massage, no? Philippine
Oh, yes.
massage. Yeah, but
Yes.
usually Filipino are making a language of like Thai massage or Swiss massage, but
Yes.
usually we have our own
Your own specialty.
Filipino, yes,
Is that right?
Filipino hilot.
Now you use also Chinese,
Yeah.
ancient time Chinese
Acupuncture
technique?
is the Chinese medicine,
Yes.
so we have that. And what else? And other we have for our diabetic patient, we have alternate hot and cold compress. Then we have hyperthermia, the fever
Yes.
bath.
Yes.
So we usually give that, but now we seldom use because of the high current.
Yes.
Then we have also the charcoal pack.
All the charcoal
So, yes,
and so
with charcoal
it's kind of
pump.
taking absorb. I think
Yeah,
it's like an absorbing.
activated charcoal.
Yeah.
So we use that for charcoal pack. For
Does it
our
actually
patients.
pull the charcoal pack pulls toxin out of
Yeah,
out of
remove
your
the
skin
toxins. It's a
through your
toxic, collector. We call it toxic collector.
Oh, okay.
So inflammations or tumors, these three when you put that charcoal.
And so it
pack.
actually pulls the toxins
Yeah.
out. Now, you've been in the United States, yes? Have you been in the U.S.?
Not yet.
Oh, not yet. Okay, but much of what you're describing is what you've personally put together as your program that has proven to work, especially on stage 1 to 3, and then you actually have reversed to number 4. But ultimately, you've also gone into teaching.
Yeah.
You have school.
We train our staff, so we open up a school for naturopathy, and because of our law now, we have the traditional medicine law, so we are intensifying now the school to offer this naturopathic. So, but we started our school in 1998.
Okay, so right after you opened the clinics, then you began teaching.
Teaching, yes.
And
you have
educating.
to duplicate, yeah.
Yes, because you have to
Yeah,
duplicate.
we have to duplicate ourselves so that more people will able to avail the services that we have.
So how are you funding all this? That's kind of, where did you get the funding to start it? Was it from your own money?
Yeah, it's our own money to start the funding, and of course we have the fees of the patients. No? So it's
okay.
internal funding,
Okay.
no outside funding.
How did you get the word out? I mean, how did you actually advertise? How did you let people know?
Yeah,
of your
90% of our patients is due to referrals because of patients who are cured. So they are referring to us, and of
best
course
kind of
there is an
advertising.
internet also,
You do?
social
Okay.
media, and sometimes we have TV programs. So,
You do?
yeah.
Good. So you're doing media on
Media,
television.
and we have our own newspaper where we promote. So yes, we have newspaper.
So you've diversified, and it's all
Yes.
through the Philippines as
Yeah.
well. So many people know, especially in the Philippines, and
Yes.
what you'd like to see happen is many more full, complete hospitals. As you have here, you have inpatient. There's many patients staying here.
Yeah.
I think 25
25
beds.
beds capacity,
Okay.
yes.
Great. And so then ultimately, then you can care from them from the beginning of the phase, that 6-month period that you've been able to cure.
Yes. But our patients stay here only for 15 days. Then they come outpatient after.
Okay.
So, but the intensive care is more on 15 days because we usually regulate your diet while doing the cleansing period.
Got it. And ultimately, with the whole system, your how much, I don't know if I should ask this, but how much would it cost? If I brought like my son
for
has
our
cancer.
1 week, now 1 week in-house patient,
Yes.
inclusive of the rooms, doctors, food supplements, therapy, and food, we have only around 50,000. That's
50,000 pesos.
$1,000.
1,000 US dollars.
Yeah, more or less like that, because we have still the discount of 30%, so that's only 35. So less than $1,000.
Less than $1,000 for the in-house care for 1 week.
1 week, but
And then-
we double that into two. It's $2,000.
And then in 6 months, you've shown nearly a perfect
Yes,
record
you can
of
see
healing.
because we have the laboratory before and after.
Oh,
So you
okay.
can we can monitor the status of the patients before
In
you
their blood.
in-house. You have complete laboratory, and whatever result that we have, the high result, we will repeat that after 15 days. Everything goes down, and the patient condition improves.
You also have your own formulas that you're actually bottling. And as a matter of fact, I just met the one of the main people from the Food and Drug Administration of the Philippines
Yes.
just a moment ago. And so you're going through and you have your own
Yeah, we have our
special
own.
blends.
Yes, we have our own food supplement laboratory, and we manufacture our own food supplements for our patients. So we have our own formula for our patients.
Great, that you put together. Now, is it off of, is there specific fruit names that you can tell me? I think it's
Yeah, we call our product is a rector herbs.
Erector herbs.
Yes.
Okay. And then you
Yeah, we have different kinds. Of
and they're made all in the
herbs.
Philippines
Yes,
as well.
yeah.
They're grown
And it
physically.
is locally grown herbs.
Yes.
Yeah.
Okay. Well, blessing. I appreciate your time. And then we're going to take a look around the hospital and see exactly all the wonderful things that you've been doing here. And this is in Manila, and then also Davao,
Yeah.
all over, and 2 other clinics here
Yes.
in Manila. And we hope to see many, many other hospitals. And that's part of what we're doing as a whole with the assets to help bring the funds that people like yourself that have the vision, know how to actually put it into practice and into materialize. You can make it materialize, and that's what we're here for, to help show the vision and assist in your vision at the Richter Clinic.
Thank
Your
you
son's
very
name
much.
too, right?
Yeah, thank you very
Very
much.
good. Thank you very much. Take
Okay.
care.
Because 1 month cleansing period or detoxification period, 3 months strengthening and balance in nourishing. So for our food supplements, we have these cleansing food supplements. We have colloidal silver as natural antibiotics. We have RMB to lower down acidity. We have charcoal or carbon, the toxic collector. We have balance gel, it balances the system. We have vital key, it eliminates toxins through kidneys. And we have better melon as blood detoxifier. So this set of food supplements is used to eliminate toxic waste from the body. Okay, this is our food served to our patient. She's a cancer patient, so she has these vegetables and a fruit and a brown rice and a soup and a juice. 70% raw and 30% cooked. Okay? Since you started 2 weeks ago, how do you feel now?
I feel better now as I started last my first week, but now on my 3rd week it's already I feel better, and even my in my removing of my bowels is now normal, and I feel stronger and light.
Can sleep now.
Yeah. Can sleep better.
Okay.
And what does she have exactly?
Our sister here is suffering from lymphoma, and she is only recently diagnosed as lymphoma cancer. So she's here for detoxification, and now she's improving. But of course, our management is still 6 months. So 1 month detoxification, 3 months strengthening period, and 2 months nourishing period. But we are hoping that she will become negative after 6 months.
And what stage is she in?
Yeah, early stage. Ano stage?
The doctor, my oncologist diagnosed me on the 4th stage of my pneumonia. When I came here,
Yes.
I was supposed to undergo chemotherapy, but I still seek for a alternative medicine where it could I could not when I don't want to undergo the chemotherapy.
Yes.
And now I found this place which was
Yes,
referred to me by
yes.
my church
I'll be there. Give me another 15 minutes.
So,
I'm sorry.
she told me that this one is
I'll be
nice
there. Just
place
please stay home, okay?
for my cancer. So I come to seek the help of the center.
Yeah, of course, with the prayers, no, we have, and other modalities that we have. So we are hopeful that she will not be suffering that 4th stage lymphoma already.
So she was in 4th stage.
Yes, 4th.
So now,
According to her, the doctor that diagnosed her 4th stage lymphoma.
so you're doing the spiritual end of it as
Yeah,
well.
yes.
That's the beautiful thing. You have your own church
Yeah.
here.
Yeah, we have our own church. You can attend our service, and we have also pastors who are coming in to do the prayers. So it's a holistic way of treatment. Mr. Abraham Javier arrived here for treatment 1 week ago. He was very weak. He is from the province. He was pale and could hardly walk. So we do cleansing process. We give this vitamin C drip, and we give also antibiotics because his disease is pneumonia or infection. But laboratory shows that his kidney is weak and the liver is weak, the lungs is weak. So we want to enhance all those weak organs.